استخدام سرايا المراقبين استهداف دبابة.
After more than 10 years of working in government hospitals, this 36-year-old doctor who did not want to be named says countless protests have not resulted in a decent salary or better working conditions. He applied to work in England. But for nearly 3 months now, he says he can't go because he's still waiting for a certificate of good standing from the government that foreign employers require.
I want to leave this country to work where I can treat people properly with all equipment and medicines. Also, I want a salary that can look after my children and my parents who paid for my education fees, and to fulfill my dreams, being a doctor.
The Senior Hospital Doctors Association of Zimbabwe says its members are frustrated by delays they attribute to the government trying to curtail a brain drain among health workers. Its leader says the government is misusing the certificate of good standing.
It will now cease to be about that. The moment we allow it to be made use of by the government in this manner, it can be abused as a way of handling labor issues rather than being a professional issue.
Dr. Msara added in some cases doctors just want to go abroad for further education and return to Zimbabwe. Health personnel in Zimbabwe have long protested about poor working conditions, including inadequate personal protective equipment, PPEs, during the COVID-19 pandemic. But the cash-strapped nation has been unable to improve salaries or provide needed supplies. Zimbabwe's Vice President Constantino Chiwenga, who is the country's new health minister, told doctors this week that he would address all their problems.
Your work will not go unnoticed. Do your best, and I will do my part. And together, we can avoid the ongoing unnecessary loss of life.
He did not talk about preventing healthcare workers from leaving Zimbabwe. Health officials said they would not comment on the issue after Chiwenga's promise of solving the doctors' problems. Columbus Mavhunga for VOA News, Harare.